To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, welcome to Your Health. Today we're going to talk about Lyme's disease, a very Midwestern topic, and we're here to talk about it with Kim and Brooke from Nutritional Healing. Hello.
Hello. Thank you.
You're welcome. So, Lyme's disease, very regional centered. Is it something where people know they have it, don't know they have it? Like, why should we test for that? What am I feeling that should make me want to test for it?
Yeah, Lyme disease is a big one at our office, and especially in the Midwest, and it's a tick-borne illness, and a lot of people don't realize that if they've been bitten by a tick or they've not been bitten by a tick, they're like, oh, it's been dealt with in the past, or I took antibiotics and now I'm better and I'm in the clear, and that's not true per se. A lot of doctors in the tests that they run miss up to 60% of well-defined Lyme disease cases. So the way that we look at it with our proprietary testing is we're looking at the bacterial DNA, but also the antibodies. And we're able to tell patients, is this maybe a short-term case? Has it been a long-term case? And what do we do about it from there versus kind of throwing a Band-Aid at it and seeing like what happens long-term? So some symptoms of someone who would want to get this testing done, Lyme disease is known as the great imitator. So it's going to mimic a lot of other diseases, and that's why we're missing it. And so a lot of symptoms that we would recommend if you were looking at persistent fatigue, if you've got joint pain, headaches, fevers and chills, rashes, not just the bullseye rash, neurological symptoms, and then heart palpitations, we'd say come in, take a peek at those. If those are ongoing, it might not be what you think it is.
So, Brooke, those would be, I don't want to say frustrating, but there could be a lot of misdiagnosis going through because of all the different things that are going on.
Yes, yes. And that's a really good point too, because a lot of times we're missing things just because the immune response is so underactive. A lot of people don't have a heightened enough immune response for it to show up in some of the testing that you're having done when you go into your doctor. So that's really what sets the tests that we utilize apart, because we're able to pick up those things even if your immune response is a little bit lower. But then we're also testing things like your tick-borne diseases, your co-infections, your viral loads that go along with that, because it's a lot more than just the Lyme itself. And there are so many other symptoms that could be indicators that Lyme could be a problem, or one of the co-infections or viral loads, like mood disturbances, skin problems, maybe hair issues, if you're having hormonal problems. So there's really a lot. It's one of those things that we can uncover if somebody's worked through and we're still having some of those residual symptoms.
Right.
So.
And Kim, it's in our last couple of seconds just as easy as giving you guys a call and getting tested.
Yes, call us at 920-HEALING or reach out at nutritionalhealingllc.com.
All right, thank you so much.
Thank you.
Thank you for watching To Your Health.